is the, in your view, what is the sequential pathology of this disease?
Um, I would say, I mean, probably for discussion's sake, I think we can take it through a few steps. Like it can range anywhere between, like I said, it starts off with an incubation period when somebody gets infected with a patient or somebody who has already got coronavirus infection. There is something called as an incubation period, wherein like you get exposed to the disease virus, but you're still not like showing the symptoms. So this lasts somewhere between 0 to 14 days. Nobody knows exactly, but it peaks at about 4 to 5 days. The symptoms start like developing at that point, and that it starts off generally as a mild disease. Then it goes on to become a moderate or a severe disease, if you want to like label it that way. And mild disease is somewhere like where a person shows just basic symptoms like a fever, continuous fever, they have cough, they have headaches, they have body aches, they might get a cold, they might have diarrhea, vomiting, and they may feel very lethargic. They don't have energy to do things. So this is how it all starts, and they don't have an oxygen requirement at that stage. So they've not yet gone into the stage of hypoxia or a low oxygen state in the body. And this all comes into a sort of milder disease. And at this point, say, for example, if you do an X-ray or a CT, it may not show necessarily like, massive changes on the lung already. And most of the people are at this stage and they recover from this stage and they never go into the next stages. And if you talk about the sequential progression, then they go into something called as a moderate sort of a phase of COVID, wherein they may start like, showing signs of hypoxia. They may become a bit more drowsy. They may start having breathing difficulty. They may start breathing at a higher respiratory rate. Like, normally we breathe at about 12 to 16 times a minute. They may start breathing at like, 16 to 18 or 20 times a minute because that is body's demand, like because body needs more oxygen and they are lacking oxygen, so they start showing symptoms of these. And this is a stage which is very crucial because either patients recover from this and get better just with supportive care or some treatments which are available in the market now, or they can progress into a severe disease, which is again characterized by organ failure. So this is the one. This is the set of patients that I am used to see because I am an intensive care specialist, and here patients are extremely ill and at a significant risk of dying because they go into multiple organ involvement. So if you take the lung, they go into what is called as an acute respiratory distress syndrome, which is commonly called ARDS, which is a life-threatening respiratory failure wherein the oxygen levels are so low that they are entirely dependent on an oxygen modality. Like it can be non-invasive, it can be invasive ventilator support, but that is the primary sort of problem that we have been dealing with all through, like in the later stages. They can also develop cardiac complications like myocarditis, heart attack. They can develop irregular heart rates, which we call arrhythmias. And if you look at the brain, a small proportion of patients can develop clots in the brain, blood vessels feeding to the brain causing strokes or sinus thrombosis, and things like that. And some of them develop like, gut complications, like, they may develop severe diarrhea, they can develop intestinal complications as well. So the last bit of things which I discussed constitute the later part of the disease, or a severe COVID is what we call. And this is, unfortunately, this is not where it ends. And people who are needing these oxygen or like organ support to go on into what is now popularly called long COVID, wherein people have symptoms and they start is still like showing signs of distress at the end of 12 weeks of symptoms. And this is a long COVID phase wherein they take weeks to months to recover.